What precautions should be taken when Xgeva or denosumab is stopped?
Xgeva, also called denosumab, is a rank ligand inhibitor. That means the drug inhibits rank ligand, that is a protein that activates osteoclast. So what does the drug do? It starves the osteoclast, and the starved osteoclast cannot really do its activity and resorb bone. When you get denosumab or Xgeva and you get treatment for instance, 1 or 2 years, and you stop the treatment, the cells are hungry and they produce, after they get their protein that stimulates the growth and the survival, they have an overactivation of their activity. That means you have an increased bone loss at the time you stop the denosumab. That means you have to get treated with bisphosphonates at the same time. So that's very inconvenient, and many doctors do not know this. So it's very important when you're on denosumab, before you stop, that you get a couple doses with bisphosphonates to stop the overactivation of the osteoclasts.
It's very effective, so it lowers lowers the effect of those osteoclasts, so those bone-eating cells, and they produce calcium. And if you stop the denosumab, they restart their program and they eat the bone again and produce those calcium and put the calcium, or kind of get the calcium out of the bone into the blood. So that's a so-called rebound, and it's helpful to have maybe one cycle of the bisphosphonates again to kind of counteract this effect. And usually it's not a big deal. We can do that. We know how to do that. You just have to be aware and have to measure it. We also recommend vitamin D and calcium because, especially where I'm from in Buffalo, we don't have too much sun. So a lot of us have a too low vitamin D level. So vitamin D, we can measure it, but also vitamin D and calcium together with the bisphosphonates or with the denosumab help to regrow the bone. It's not proven, but the theory is very strong that this is true.
Myeloma bone disease experts at Massachusetts General discuss the use of Xgeva. They'll sometimes bridge and they'll stop the Xgeva and give us a few doses of Zometa. To my knowledge, there's almost no data currently in myeloma to really address this question effectively, and we're extrapolating in the osteoporosis literature and how it might be affecting myeloma. We don't know the right thing, and that may be the best way to do it. Oftentimes, patients who get stopped on their Xgeva or Zometa are doing it for a reason. Sometimes they're done with therapy, sometimes they've had a complication, and both of those could affect your willingness to have a bridging therapy. You don't want to have necessarily bridging therapy if you're stopping Xgeva because of osteonecrosis of the jaw, whereas you may be willing to do it if you're stopping it simply because you're ending therapy for myeloma.